Hi, this is Dr. Rena Azar for Dr. Brainwaves, and I'm going to talk about ectopic pregnancies today. I think it's important for people to be aware of this condition. Here's the female reproductive tract. We've got the vagina, the uterus, the tubes, and the ovaries. And the important point here is that even though pregnancy usually occurs where the egg and the sperm meet in the tubes, and then they travel very nicely to the uterine cavity and implant, actually that pregnancy can implant in the wrong place. Sometimes the pregnancy implants in the distal tube by the ovary, up in the abdominal cavity. In this area, there's an area called the cornua, right here, and the cervix right here. Those are two areas that are too small to support a pregnancy. Therefore, those pregnancies, which like any pregnancy, get a very large blood supply, will be at risk for a condition called ectopic pregnancy, planting and growing in the wrong place. And the risk there is that because they're pregnancy tissue and they are incredibly vascular and they always grow, pregnancies that are viable always grow early on. And inevitably, it will become non-viable, not a pregnancy that can survive because it's in a location where it cannot grow, expand, and get this blood supply that it needs. And when people get an ectopic pregnancy, they will get inevitably a rupture, a blowout, or a condition called hemoperitoneum, which is blood in the abdominal cavity that occurs when that pregnancy outgrows the area that it's in and breaks open. So how does it present? People who have ectopic pregnancies have a pregnancy that's usually associated with some abnormal bleeding. So they'll have abnormal bleeding. At some point, they'll start getting pain because of the expanding tissue in the wrong area. And so they'll present with a variety of symptoms early on. But if that area blows out and bleeds internally, then there are some other different symptoms. As the body accumulates more and more blood internally, which can occur very abruptly or slowly over time, people will get different types of symptoms. When there's a severe amount of blood loss, the heart will try to compensate by beating very rapidly. People will notice pressure sometimes in the rectum or the bladder as the volume of the blood increases. People will get an irritation of the diaphragm, which is a muscle that comes across and separates the chest cavity and the abdominal cavity. When the diaphragm gets irritated, you will get a radiation of pain, usually to the right shoulder. So there are a variety of different symptoms that can occur as the blood accumulates in the abdominal cavity. And I cannot emphasize enough that a young, healthy woman can potentially show no signs of blood accumulating in the abdomen until they literally have a couple gallons of blood, and it's therefore life-threatening. So people will come in this type of situation. Any OBGYN will have seen this numerous times in their career. So it is a condition that is relatively common in the practice of obstetrics and gynecology. The important thing to know is if you have a pregnancy associated with some pain or abnormal bleeding, first trimester, go see your doctor. How do we find it? Well, it can be a little tricky. Early on in the pregnancy, people will have a count that is low. And we know that we can follow that count and see a specific rise that we expect if it's a healthy, normal pregnancy. If it's not giving that rise, then we might say, hey, this is suspicious for an ectopic pregnancy, or this is going to be a non-viable pregnancy of some form, which could be either an ectopic pregnancy or a miscarriage. But we want to make sure not to miss the ectopic pregnancy, to make sure that that patient is educated about what an ectopic pregnancy is and how it might present. But oftentimes early in the pregnancy, we cannot tell with a single look at that person and at their blood work if it's a pregnancy that's going to live or not. So we have to follow it over time. Obviously, if somebody presents with an abdomen full of blood, we know there's something wrong. We go inside and we'll find it. Finding it sometimes requires an ultrasound if you're far enough along where we can look and see where it's located, or sometimes it's a matter of getting in the abdomen, cleaning the blood out and looking for the pregnancy tissue and removing it, because usually you have to remove it so that it stops growing and recruiting blood supply and putting you at risk for current continued bleeding or bleeding in the future. If we catch an ectopic pregnancy really early in the pregnancy, in the first trimester, There are certain criteria we follow, but if you fulfill those, then you can have a simple treatment called methotrexate, which is a shot that you can get for an ectopic pregnancy to dissolve the tissue. That's a really nice intervention that does not require surgery. You will have to be monitored a little closely initially because you can still get some rupture with that, but it is certainly less problematic than having a surgery. If you have a surgery, sometimes we have to hunt around. If it's in the abdomen, we have to hunt around and try to find the tissue. If we can't find it, we might have to do methotrexate anyway afterward. As long as we know there's no active bleeding inside, we're okay. Sometimes we see the tissue in the tube. We can actually see it in the tube, and we make a little incision, a little slit. We go in, we get that tissue out, and that's actually, believe it or not, it's associated with fertility rates that are just as good as if we use methotrexate. So that is what an ectopic pregnancy is, what it puts you at risk for, symptoms that you might present with. And I like to also mention that there are cases where people have had a hysterectomy, either a total hysterectomy or, total including the uterus, not the ovaries. Obviously, you'd have to have ovaries, but a hysterectomy with a little fistula or a little hole between the vagina and the abdominal cavity, or a supracervical, meaning if sometimes a hysterectomy is done where just the top of the uterus is taken out and the little cervical stump is still there. And folks that have had that procedure have gotten pregnant before. So, and in addition, I've seen this, I read about this a long time ago, and I'm glad I did, but sometimes the fetal tissue, the baby tissue, dies out, no longer produces pregnancy hormone, but it still is having a good blood supply. It can rupture open. I had a patient come in with a completely negative pregnancy test and a belly full of blood, and lo and behold, went inside, laparoscopically cleaned everything up, and found an expired ectopic pregnancy. So got that tissue out of there. She stopped bleeding and was safe. But nonetheless, that's ectopic pregnancy overview. I hope you find that helpful and that you keep that in mind if you have an abnormal symptoms in your pregnancy.